Welcome to this special episode of our NICUnity podcast. Today's episode is a celebration of the impact that parent organizations from around the world can have when they work towards a collective goal. In this case, we came together to develop a global information platform for NICU families called Neopedia. My guests today are two leaders in this global community that were instrumental in bringing this vision to life. Denise Suguitani is an activist and advocate for the cause of prematurity and the executive director of the Brazilian Parents of Preemies Association. She is also a member of the World Health Organization's Global Committee for the Decade edition of the Born Too Soon report. Denise believes that prematurity burden is both individual and collective. It impacts everyone in different ways. Preterm babies and their families in Brazil, which is among the 10 countries with the higher prematurity rates, still face basic challenges, and she and her team want to change this. Bianka Gallina is a communications manager at the Global Foundation for the Care of Newborn Infants, where she works on international communications in the healthcare space. Her academic focus on cross-cultural communication has gone hand in hand with a career that's taken her across borders into diverse cultural settings. Bianka is passionate about newborn health and wants to use her communication and project management skills to help improve outcomes for newborns worldwide. Her strengths lie in making complex ideas accessible and in connecting people across borders through clear, thoughtful communication. We hope you enjoy the episode. Well, Denise and Bianka, thank you so much for being here today. Let's just go ahead and jump right in. So this is a really exciting day because we are announcing a global project led by the Global Foundation for the Care of Newborn Infants, or GFCNI, in collaboration with parent organizations from around the world and global experts. This project, called Neopedia, is a multilingual information platform designed to support families and caregivers of babies born preterm or sick. By providing reliable, accessible, and expert-reviewed information, it will empower families to better understand their baby's care and advocate for their needs. Neopedia also connects families with their national and local support organizations to ensure that they have the resources and knowledge to navigate the challenges of neonatal care, prematurity, and beyond. So Bianka, who is one of the GFCNI leads on the project, and Denise, who is one of the parent organization leaders who worked on the project, thank you so much for being here. I'm really excited to talk about this project. So let's just get started a little bit. Let's share a little bit about each of your respective organizations and some general background. So Denise, let's start with you. Just to give us a little bit about your background, why your organization was created, and what you do to support families.
Okay, thank you, Kira, for the invitation. It's an honor to be here today. Well, I'm a nutritionist. My background is in clinical nutrition, and I used to work in a NICU. And while I was working, I had my kids, my babies, in 2008 and 2010. They have 2 years difference. They were not preemies, but as soon as I became a mother, I completely changed my view surrounding the NICU environment and all the experiences, the journey that parents go through. And at the time, there was no platform or website or anything more robust, bringing information for parents and support online. And then it started as a blog. And then because Brazil is one of the 10 countries with the highest number of preterm births in the world. So we have 12% of our births are preterm. So it's around 3,000 preterm babies a year in Brazil. 300,000, I'm sorry, 300,000. So 300,000 families that go through this experience every year in Brazil. And at the time, there was no website talking about it. It started as a blog. But then as soon as we understood the urgency of this matter in Brazil, and then we had so high rates of preterm birth, we decided that as an organization, a non-profit organization, we could reach more families and help more people and change the scenario to give information to try to prevent when it's possible to prevent preterm birth, and the majority of the cases we can. And when the baby is born preterm, what we can do for the families. We have to uh, tell them what is their rights, what's best for the baby, so they can fight together with us. So that's how everything started in 2014. So we turned 10 years last year. And so our focus is to try to prevent preterm birth and then to fight for the rights of the families. And the rights of the families are access to the best that is available on the market for drugs, vaccines, therapies, and everything. So that's our main goals here in Brazil today. But then I'm not a preemie mom, but then I'm sure that maternity is something that is shared with all moms and that changes us forever. And I'm very grateful that I carried this flag here in Brazil together with the families and professionals.
And so how does your organization do their work? Are you providing support at the bedside? Are you working on policy in
Yeah.
Brazil? Tell me a little bit more about that.
We do literally everything. We do all of this. We work a lot with public policies. We work directly with government to change and to improve and to present new bills, to implement new laws that are of interest of the families. So we work very closely to parliamentarians and with the government. And we also provide psychological support, legal advice for families, everything for free, of course. We have groups of support groups, peer support groups as well. And we do the whole year campaigns, awareness campaigns. So this month is Kangaroo Care Day. We also have today in Brazil the International Human Milk Donation Day. Then we have Preeclampsia Day. And then, of course, we have Purple November, the World Prematurity Day. So we try to engage the society in all these related causes during the year to show them that it's not only a public health problem, prematurity, it's intersectorial because it's related to social assistance, to human rights, to education, to economy a lot because it's a big burden for the system, the health system. So we are always trying to show and to do this literacy, family literacy on this information, this data, and their rights as well. And we have 230 volunteers all over Brazil that are parents, professionals. So they are the big ambassadors of the cause and of the work that our organization does. They carry out, they spread the word. So we have these volunteers that are the core, are the center of our work.
That's wonderful. Now, most of our listeners are American. So could you share a little bit about kind of the healthcare landscape of Brazil? And what I mean by that is when we look at the United States, we have 50 states, we have over 400 NICUs across the country, very similar preterm birth rate, 380,000 babies born preterm. And we have a lot of maternity care deserts where there's no access to care, or families have to travel, hours to get to the closest children's hospital. We'll be in separate hospital from their baby. So tell our audience a little bit about what's it like in Brazil to be in the NICU or to be able to access care.
Okay, I think it in certain ways is similar to the US because we are a continental country and we have this like empty spaces with no assistance at all. We have still a lot of indigenous tribes and people that live by the rivers and the small groups of people, and it's very hard to reach them. And we have the social differences and all the inequities that we know that have a lot of influence in access to health. So in some states and some cities, we have great access even to public health because the majority of people use the public system. But unfortunately, it's something that it's a big burden for us, the access to health and also the quality of healthcare, like the quality of prenatal care, for example, all the information that is passed and all the exams that women have access through it. But I think in a way it's similar to the US because we have this very different that's exactly what we don't want. If the baby is born here, he has 90% chance of surviving and 80% chance of having a good health and good prognosis. And it's very different from the city that is just next to it. So
Mhm.
it's something that's very hard to, you have to work locally. So that's why
Mhm.
the volunteers are so important because they bring us this cultural and these regional differences so we can tackle this together in a national level, national law, but also looking at the region specifically and trying to adapt to the culture and to their main challenges.
Mhm. Thank you for that. I appreciate that explanation. Bianca, so in addition to the launch of Neopedia, we're also celebrating the transition of EFCNI to GFCNI, which is very exciting. Congratulations. I know that that has been a lot of work, a long time coming. For those who aren't familiar with EFCNI or GFCNI, could you give us a little bit of background and the history of the organization, which is based in Germany?
That's right. Thank you, Kira. Um, the heart of it all was a personal experience. So the journey of EFCNI began with Silke Mader, one of the co-founders. After delivering her twins, extremely preterm, facing complications and loss, she realized how little support existed for families like hers. And so this was the experience that fueled sort of the vision for systematic change, not just in her home country of Germany, but across Europe. So Silke took a leadership role first in the German umbrella organization for preterm babies, but the need for sort of unified voice at the European level sparked the creation of EFCNI back in 2008. And the aim was to bring together parents and healthcare professionals and decision makers to improve the outcomes for newborns and amplify the voices of families in neonatal care. And so that's how it all started. Just a year later, EFCNI launched the first World Prematurity Day, which since then has really grown into a global significant movement. And so as the organization and the community grew, so did its reach. And that's why in 2019, the birth of GLANCE, the Global Alliance for Newborn Care, marked the first step towards this change, towards a global advocacy and a global network under the umbrella of EFCNI. But to fast forward to today, so after 17 years, we have transitioned now from a European foundation to a truly global one, the Global Foundation for the Care of Newborn Infants, so GFCNI. And this rebranding really reflects who we've become throughout this journey, just a global voice for newborn health and family support. And right, so what we do today is manifold. Most importantly, GFCNI plays a role in educating and training, as well as advocating for newborns and their families at the highest levels. So we support parent organizations, patient organizations around the world, equipping them with tools, knowledge, confidence to advocate for the change in their own countries. A great example for this is our annual Patient and Parent Organization Summit, which this year, just a couple of weeks ago, brought together more than 70 representatives from, I believe, over 45 organizations and about 30 countries. And yes, so GFCNI also represents the voices of parents and babies in, for example, developing guidelines or influencing policy and participating in the legal processes which shape and change neonatal and maternal care. Maybe I can quickly mention as well, one of our newest initiatives is the HOPE study. This is an international research project with the goal of gathering insights directly from parents and caregivers of hospitalized newborns from all around the world. And then, of course, coming to Neopedia, this is our new global information platform supporting families and caregivers of babies born preterm or sick. So as part of GFCNI's global mission, Neopedia really aims to equip families with the confidence to navigate prematurity, hospitalization, and what comes after.
Thank you for that. It really is just amazing what GFCNI has been able to accomplish in bringing all of these global parent organizations together from all different sorts of countries too. It's not just the wealthiest countries that are, a part of this community. It really is a global, and we as NPN are so fortunate to have been a part of it for the last several years, and very happy to be a part of many of the collaborations that you lead. So let's talk about Neopedia, because that's why we're here today. It really is a global educational platform. It really was a global effort to create this. So Bianca, when the website launches, can you give us an overview of what we can expect to find?
Definitely. So at the top of every Neopedia page, there will be a clear and structured and sort of navigation bar so that the users can quickly find the topics that matter most to them. The platform is built around 5 key stages of the neonatal journey, which helps families find the right information based on where they are in their own experience. So I'm happy to walk you through these 5 sections. We start with a broad overview of neonatal care. And this includes an introduction to prematurity, important facts and figures about preterm birth, and an explanation what NICU care typically involves around the world. It's basically designed to give families a foundation and help them understand the context of what they are experiencing. So the second section focuses on pregnancy and birth. It covers the risk factors and causes of preterm birth, as well as signs and symptoms to watch out for. There is also practical guidance on how to prepare for a potential NICU stay. For example, what to expect when visiting a NICU, how to connect with other parents, and where to find further support. And in this section, pregnancy and birth, we have included detailed explanations of delivery and possible complications which are treated in a NICU. But we've also added gentle disclaimers, so to say. We always encourage parents to read only what's relevant to them so that they don't feel overwhelmed by too much or too heavy content. Exactly. And so finally, the pregnancy and birth section addresses also the emotional aspect of navigating, for example, a future pregnancy after a NICU stay or a loss. So moving on, in the third section, we have the NICU experience. This is all about the NICU journey itself, introducing the NICU team, equipment, tests and procedures that families might encounter. And we place a very strong emphasis on parental involvement here, highlighting topics such as skin-to-skin care, feeding, diaper changes, and bathing your baby in the NICU, just as a few examples. Very importantly, there's also a dedicated mental health section, which explores the emotional challenges that families face, including uncertainty, loss, and bereavement. So we know that this is a delicate time and wanted to give the content to reflect with compassion and care. But the journey doesn't end when the baby is discharged from the NICU. So the fourth section, very important, called Going Home and Growing Up, which focuses on the life after the NICU. We have here practical advice on preparing for discharge, managing care at home, and supporting your baby's development as they grow. For example, we have checklists to help with the transition to home, guidance on topics like feeding, bathing, using medical equipment at home, and knowing when your baby might need medical attention. We also cover follow-up care, including, for example, early intervention, immunization, therapies, and developmental support right through to school age and even adolescence, all the way into adulthood. Because we know that this kind of information is very often hard to find, and it's very important for preemie families to be able to advocate and find the optimal care for their NICU babies as they are growing up. And yes, so finally, the fifth section is just for parent support. This is the content that covers how to involve family and friends in your NICU journey, how to cope with stress, uncertainty, how to find peer support. And this is where we also link to national and local parent organizations so that families can connect with the groups near them, which is, of course, a huge source of comfort and practical support or advice. Exactly.
Well, I can't wait to take a look at it and to be able to share it with everybody. Now, obviously, Denise from Brazil was a part of this development. I represented the United States. What other countries were part of this global development of Neopedia?
Right. So we started out with 5 languages at launch. Neopedia is available in English, French, German, Italian, and Spanish. And so to keep things manageable, sort of in the project team and to make sure that everything was done well, we teamed up with 14 parent organizations, of course, yes, including NPN and the Brazilian association. Help me out here, Denise. Brazilian Parents of Preemies Association. Exactly. And so they have helped us shape the content and the whole structure of the platform. This was really instrumental in making sure that Neopedia is developed by parents for parents, and the target audience is, of course, parents and families of babies born preterm or sick. So the feedback we received from these organizations was very important. And right, so basically countries representing these languages spoken were part of the project, and also including more, because we will be adding languages in the coming months and years to come. The next ones will be Portuguese, Greek, and Turkish. These are in line, and we are very excited to be adding them to the platform.
Yeah, it was really interesting for me when I was, when we were going through even just deciding what to name it, and to just the discussion among the leaders from different countries, and just talking about just words in general. And, oh, well, that word really doesn't mean anything in my country, so it would not, translate well for us and wouldn't be helpful. That was probably one of the most striking things that really opened my eyes to just, we are a global community, right? But we do have to be very sensitive and cognizant of the language that we use. Denise, was there anything that kind of struck you throughout the process? Just anything that comes to mind that really kind of stood out to you?
A lot of things. I think the website itself, it's a big accomplishment, because it's so challenging to gather all these different cultures, different just small words that change everything, the meaning for one country and the other. And it's not easy to put that all this, it's a lot of contents, a lot of sections. The website is amazing. It's very complete. It's very warm at the same time that has information that sometimes are tough information. It's welcoming. And I think what struck me was to see that we have this common challenges and also that in the end the things are a bit different from country to country, but in the end we are kind of united in the care that we want to our preemies. Like for example, we have here in Brazil our big public policy that rules the NICUs are we call it kangaroo care, but it's a public policy that is not just about skin to skin. It's all the family integrated care protocols. It's more or less the same that we have at the other. It's not only FI care, well, need cap as well. So all these protocols are very similar. So we are united in this voice of how we want the care of preemies to be humanized and to be the best for them. And but it's wonderful to see these differences in cultures and try to gather all these things together. But I think that's the main goal of the platform. And for us, it's wonderful to have something that has this global foundation behind it, and then we can have this. It's backing us, and when it comes to the national level, the cultural directions, they lead to our websites and the work the organizations are doing at the national level. So it amplifies the visibility and also the literacy of families, and that's great for everyone.
Absolutely. I think that that's very well said. So, how do you think that you will use Neopedia with your organization and the families that your organization support?
Yeah. Well, as I saw in the website, there are a lot of contents that we don't have in our website. So we will definitely use it to direct families to that content. And then this, you can look here. It's not our website, but everything that is here is correct for our culture and our public policies as well. So that's what we should be doing here as well. And then there's a lot of sections that we don't have in our website. So for us, it will be very useful, and also that something that is bigger that backs us, because when people see that we are a big network, a global alliance working together, it gives us more strength and more credibility to our work here. So it will definitely help in a lot of ways, being part of it and disseminating the Neopedia.
Absolutely. And Bianca, you mentioned that we're starting off with English, French, Spanish, German, Italian. Is that right?
Right.
Yes. With which are obviously kind of some of the more well-resourced nations across the world. What is the plan to reach countries that are not as well-resourced?
Yes, so this is in the long-term plans of Neopedia's future. Currently, the content that's featured on the website on Neopedia is directed more at upper middle or high income countries, since we talk a lot about specialized care, about NICUs, incubators. So this is what you will find in such regions of the world. And when it comes to reaching families in lower income settings, even the way the information is disseminated has to look different in some ways. So, a website that can be accessed just online is not the right way to reach many families that need this information. So it will be a very exciting journey for us to figure out how to best support and really reach all the families that are in need of such support.
That's great. Well, I look forward to seeing how that comes to be and just learning from that process. I think will be really exciting to be a part of in whatever way that we can support it. One of the things I think that we've all talked about is health literacy and just the importance that knowledge really is power, specifically for families, because when you go into the NICU and you don't know what to expect, you don't know what's happening, when you get to that point where you have some sense of comfort, where you understand what's happening, you begin to gain that knowledge of, the people that are in there, the things that are happening, what to expect. It really does help you feel more confident as a parent. So tell me, either one of you or both of you, kind of from a global perspective, let's talk about the importance of access to information and how that relates to outcomes for babies.
Bianca,
Go
you
ahead,
want to
Denise,
start?
or
Oh,
Bianca.
okay. Okay, no, I was just, well, of course, I knew that we were going to talk about health literacy because it's what we do. Our aim was to give information to families because we know that information has the power to change destinies. And I think that's all about Neopedia as well. And so I was researching about that, and there is some studies that show that when you have more health literacy in a population, you have less hospital admissions, avoidable hospitalizations as well, vaccination, fewer emergency department visits, lower cost per beneficiary of the public health system. So it's a lot of things. And talking about our public in specific, they are in a very fragile moment of their lives, and probably the most extreme experience they will have in their whole life to see their babies fighting for their lives. And I think information is everything, but we have to know when to give this information and how to do it. So it's important that all the NICU staff and all the healthcare professionals that work with families, not only in hospitals, but at the community here in Brazil, we rely a lot on the primary care, also at the community primary care health system. And it's important that they are trained not only in the technical parts, but also on the soft skills, like they can be trained for that, how to deliver information and when, because this is a very different and delicate public, these families of preterm babies. So, yeah.
Yeah, I think that's one of the beautiful strengths of this is that the content is parent led. And that is what makes it so special. I think that's what I think is going to make it so accessible. And, there is a big difference when you're handed some information from say, a professional provider association of neonatologists about whatever topic it may be, versus something that is maybe developed by a parent-led organization in conjunction with the experts. Like you said, the language will be different. It will be more trauma informed, which will make it more easy for the family to take it in and to understand, instead of just being completely terrified of what they're reading. And I think that that's going to really be one of the great successes of this platform, because there was such a good global lens from parents and those who work with parents on a daily basis. Bianca, is there anything you want to add?
Yes, I think the point of the use of language was really central from the beginning of the project. From day one, we really wrote the content so it is easy to understand. We kept the use of language at sort of a grade 8 level, I might say, so that it's easy to understand, also focusing on being warm and inclusive. And what's really great is one of the features that we've added is words or terms which are more complex. We have sort of definitions throughout the text, noted with these small question marks, so that readers can learn as they go without needing any prior knowledge to understand what it is that they are reading. So this was a very important a part, and actually this idea also came from one of our parent representatives from one of our many check-ins. And maybe just to add as well, regarding the information and health literacy, I think one of the most powerful things that Neopedia does is empower parents to participate in their baby's care. And of course, we know how critical family-centered care is. And so Neopedia provides the information on how parents can be involved, whether it's through skin-to-skin care, breastfeeding, or simply being present. And for families who aren't automatically offered that involvement, we hope that the information really gives them the confidence and maybe even the push to ask for it and to say, I belong here too for the optimal care of my baby.
Yeah, absolutely. I think that the fact that too, that you really are highlighting the national and local organizations, because it is really important to be able to connect with those resources that are specific to where you are. For instance, I would have a hard time, supporting a family in Brazil because I know nothing about Brazilian healthcare or where the resources are, but having those connections. And I think with this global world where you get contacted by families from all over the country, the fact that GFCNI has created this trusted network of parent organizations so that we can each know, okay, well, this family really needs to go talk to Denise because that's the one that's really going to be able to help them, I think is just really beautiful. And it's just really, I'm always impressed every call that I'm on, every meeting that I'm on with the other parent organization leaders, just absolutely amazing work that's being done around the world. And like you said, Denise, even though we have cultural differences and there may be some language differences, we are all working for the same thing. And that is for families and babies to have better outcomes and for families to be integral into the care of their babies. So any last words or thoughts or comments that we didn't get to before we close from either of you?
I just want to say that I'm excited about the Portuguese part that we are going to have later. We will definitely have some issues about some words for the Portuguese in Brazil and Portuguese in Portugal, but we always tackle this and it's okay. And I think the beauty of this project is exactly what you were saying, Kieran, and this unity and to see that there are so many people working for the same cause and that our voices are always more visible and louder and that there's no way back. So it's wonderful to see that, and I'm very excited and grateful to be part of this project.
And I would just love to give a shout out to everybody who collaborated on the project, including both of you, Kira and Denise. Both your help was absolutely instrumental, and all the other parent organizations, as well as our more than 20 medical experts who have volunteered to review and gave their name to the content that's featured. Of course, making sure that the content is also correct to the very last words was one of the most important points. And so their support was also very important. And of course, last but not least, the unconditional support of Kiesi, because of whom this project has come to life. So
Absolutely. Well, and a big thank you to you, Bianca, for all the work that you and your team have done, to Silke, to GFCNI for recognizing this gap in information and recognizing this need and working so hard to bring everybody together. It's not an easy task at all. So thank you so much. We have been absolutely delighted to be a part of it. So thank you so much, Denise and Bianca, for your time today. Your work is incredibly valuable. to improving the outcomes of countless neonatal babies. And we are grateful, truly grateful to be a part of your global community. So we will definitely be sharing all the resources and links in our show notes, and to make sure that that everybody has access to this new platform. So thank you both so much.
Thank you.
Thank you.